Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. We're going to be speaking with Tushar Malhotra this morning, Director for Interoperability, Strategy, and Business Development at eClinicalWorks. Welcome to Health Professional Radio, Tushar Malhotra. Thank you for joining us this morning.
Thank you, Neil. Thank you for having me on the show.
Well, Tushar, give us a bit of insight into what eClinicalWorks is all about.
Yeah, sure. So, Neil, eClinicalWorks has been around for 20 plus years in outpatient doctors' offices and as an electronic medical record solution. And over the years, we have evolved our product line to include patient engagement and population health products. When we were initially founded in 1999, there was a simple goal to get rid of paper in the doctor's offices and make every connection possible digitally, whether it's to lab companies or to pharmacies. And that was the need at that point in time. Now the interoperability landscape has changed drastically, and the providers at the point of care need to be able to exchange data with a wide variety of stakeholders like other hospitals, other care locations where the patient is receiving care at, payers, public health, for instance, like immunization registries, especially at this point in time with the pandemic going on, and the patient themselves. So now the need is much more than just being able to e-prescribe or order labs electronically. And accordingly, we have evolved in our interoperability and integration solutions at eClinicalWorks to adjust to the customer needs.
Now, what specifically is your role at eClinicalWorks, Tushar?
So I lead the efforts when it comes to eClinicalWorks strategy for interoperability for the past few years now. Even though state and regional HIEs or RIOs, as we call them, have been around for many years, there were huge gaps as the patient care is not always local or regional, and the providers in the care continuum were not always able to get accurate and timely access to patient data. So in 2016, I was tasked with making provider-to-provider data exchange at a national scale a reality, and that was the need of the hour from our client base at that point in time. This was the same time when both Carequality and Interoperability Framework and Commonwealth Alliance were in their infancy stages. So under my guidance, eClinicalWorks committed to join both initiatives as a contributing member right away to allow for query-based document exchange so relevant health data can be made available to individuals and caregivers regardless of where care occurs. So at this point in time, I'm on the board for Commonwealth and the steering committee for Carequality, and help shape the eClinicalWorks interoperability roadmap for the future.
Now we're talking a massive amount of records per month, aren't we? How exactly is ECW, navigating the problems associated with, liberating that amount of data?
Yeah, in fact, that's very well put in terms of the problem statement. We are at a stage now where within the eClinicalWorks EHR, it is as easy as flipping a switch to get connected and enable access to these nationwide networks, Carequality and Commonwealth. Like just last month, our practices exchanged 50 million records on shared patients across other care settings, which include almost 4,000 hospitals and 50,000 plus other care facilities, which could be primary cares or specialist offices or long-term post-acute care facilities and skilled nursing facilities. So this data starts being exchanged as soon as the patient is marked as arrived at the eClinicalWorks provider's office, assuming patient consent is on file. So which is an important component of this entire exchange. So currently, I'm leading the deployment of our latest tool called Prisma, which makes all this data exchange to Carequality and Commonwealth very usable and searchable. So that's the next big thing when it comes to the technology that eClinicalWorks is producing to help our providers with this huge amounts of data that's come through these networks.
How about securing all of this information as it flows from one provider to the next and even to the patient themselves? What types of problems is ECW working through in that arena?
So all of this is managed through these nationwide networks, and there are certificates and appropriate security protocols that help this information to stay secure while it is in transit or at rest. So all of that is managed through that piece.
Are your platforms strictly a replacement for existing information platforms within a facility, or are they designed to seamlessly go along with?
It's not really designed to replace anything. It's something new that we are giving to our customers. So because providers are inundated with information that comes from the outside world, Prisma is helping them sift through that information and make it more searchable and all of that. So Prisma is the industry's first health information search engine that analyzes information from these nationwide networks like Carequality and Commonwell and helps the providers sift through most clinically relevant information promoting efficient care. In the age of value-based medicine, having comprehensive clinical data at the point of care is vital for practicing safe and effective medicine. So Prisma helps establish that longitudinal view of patient data that providers need to make informed health decisions. In addition to the external data that Prisma is able to get through these networks, it neatly organizes internal progress notes in a timeline view so the providers can get a consolidated view of what has transpired with the patients since they were last seen across all care settings. I think that's the tool that we are providing to our client base, which is going to revolutionize how information is accessed and managed.
Talk a bit about the training and support once a facility is on board with eClinicalWorks.
Specifically to these products, we are providing the entire training through webinars and through other education platforms for our customers to be able to learn more about these interoperability suite of products. And then we are also giving them the support option so that if they have how-to questions or any technical questions in regards to this information exchange, they can just create a support case and be able to get connected anytime with our providers.
Specifically when it comes to the pandemic, did ECW find itself having to shift strategies based on the pandemic?
Right. So the pandemic has put immense pressure on the healthcare system, and it has exposed cracks each step of the way, and basically has exposed critical gaps that exist in health information exchange nationwide. Using these nationwide networks, our providers were able to get access to, let's say, the vaccine information that this patient is being administered elsewhere, or the testing information that this patient was tested for COVID elsewhere. So all those pieces were really critical, but there was one important component when it comes to being able to exchange data with public health. So case reporting, the public health needs to know, the local and the state jurisdiction need to know when the patient is being tested positive for COVID. And those case reports, we are now planning to support through the Carequality framework again, to be able to submit those data through a national framework into a central repository. So that is something which was not there or not part of our strategy prior to the pandemic, but now we have included that as part of our plan.
Well, give us a website where we can learn more about eClinicalWorks, if you would, Tushar.
Yeah, specifically to interoperability, you can go to eClinicalWorks.com/interoperability, and that's where our entire suite of products that we provide for interoperability and integrations are listed out there.
Well, I appreciate you joining us here on the program this morning, and I'm hoping that we'll speak again.
Great. Thank you, Neil. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Tushar Malhotra, Director of Interoperability Strategy and Business Development at eClinicalWorks. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/healthprofessionalradio.